Hi, I'm your host, Marsha Florence for Just Ask. Today, our show is the Sickle Cell Disease Association of America, the Michigan chapter. Hurry back and join us. Welcome to the show. Today is the Sickle Cell Disease Association of America, the Michigan chapter. And as our guest, we have the Executive Director, Jatan Milton. Hi, Ms. Milton.
Hi, how are you?
Glad to have you here with us.
Glad to be here.
Okay. And next to her is Dr. Whitten Sherney, pediatrician of the Comprehensive Sickle Cell Clinic. How are you, Dr. Sherney? Okay. And our far left is Maxine McBride, treasurer of the Cynthia Cole Circle and board member of the Sickle Cell Disease Association of America. How you doing, Ms. McBride?
Doing great.
Good, good. Ladies, thank you so much for coming to see us today.
And thank you for your invitation.
Okay. Now we had a mouthful going on there with all these wonderful titles. So if at any point that I have misspelled or mispronounced anything, feel free to correct me, and I'll be glad to make the correction.
Very good.
You did great.
Okay. Thank you. So we want to start off with you, Jatan, about the, may I call you Jatan?
Yes, you may.
We want to start off with you and ask you questions about the Sickle Cell Disease Association of America and your role there as Executive Director.
Okay. We have a very long title, as you know, the Sickle Cell Disease Association of America, Michigan chapter. So for sake of brevity, I'm going to refer to it from now on as the Sickle Cell Center.
Okay.
The Sickle Cell Center started in 1971 by our founder, Dr. Charles F. Whitten, who remains with the organization and is currently, in addition to founder, he's the board of directors. He's the chairman of the board of directors of the Sickle Cell program. Okay. The Sickle Cell Center started on August 1st, 1971. Initially, we started at Kerwood Hospital, but we've been at our present location on James Cousins since 1973. The Sickle Cell Center provides a number of different services related to sickle cell disease. We have social services, career development, tutorial program. We also do education testing to the community at large. We do public presentations. We do and participate in displays around the city upon request.
Okay.
So that's we're still in service. This year is our 35th anniversary of service to the community, and we're very proud about that.
Okay. Well, you know, a lot of people don't know a lot about sickle cell in itself and how it comes about and the history of the organization. Is it considered an organization or an agency? What is it?
Agency.
Agency. Okay. So they have very little knowledge, and that's mainly one of the reasons we wanted to hear from you all today in reference to the information that we can get out to our viewers.
Very good.
Okay. Very so, Dr. Sherney, I know somewhere in there was Whitten Sherney, so I believe there's got to be some relations in those names there.
Close familial relationship.
Okay.
There. Yeah, that's
so you want to? Okay. I kind of realized. I said she said Dr. Okay. So your father is the founder.
The founder.
Okay.
Agency,
Okay. And can you tell us about your role with this agency itself? And
okay. Well, I actually serve as a consultant for the agency.
Okay.
But I am a pediatrician, and I do the general pediatric care for children that happen to have sickle cell disease in the Sickle Cell Clinic at Children's Hospital, where we have a hematologist and nurse practitioners and phlebotomists and have comprehensive care for children that happen to have sickle cell disease.
Okay. So now, did you become involved in relations to the relationship of your father, so more or less, or that's just your main practice?
I would be lying if I didn't say it had anything to do with my father. I actually did a pediatric residency and decided I was interested in hematology, blood diseases in children, and I did a year of a fellowship in hematology and oncology, and I went to 9 funerals and it was difficult. And my last rotation in my fellowship was at the Sickle Cell Clinic. And of course I knew about it because I'd had all the literature and so forth around my house, but when I got there, it was just such a wonderful place that I decided this is where I'm going to stay. And so I didn't actually complete my fellowship, but for the past 17 years I've been taking care of children that have sickle cell anemia.
Well, I know your father's proud of you.
Oh,
okay.
And I of him.
Okay, well that's a wonderful. Okay,
Yes.
okay. So it ties in beautifully.
It does.
Okay, and being a member of the board itself gives you insight on what the association is trying to accomplish.
Right. Now, I'm not actually a member of the board, but I do some consulting for the agency.
Okay.
Yeah.
Okay. Well, Maxine McBride, we don't want to leave you out there. And what is your role and involvement with the Sickle Cell Center?
I'm representing a fundraising group, the Cynthia Cole Circle of Friendship Baptist Church.
Okay, and Cynthia Cole is who?
Cynthia Cole was a member of Friendship Baptist Church. She died at age 21 in 1976 from sickle cell disease. And the circle was named after her and organized by a former pastor. And we are a fundraising agency for the center, and also we provide funds to the parent group to help them send sickle cell children to camp.
Okay.
And over the years, we have, this was our 30th anniversary this year, and we have given close to $100,000 to the agency from our fundraising events. And also part of our program is to make the public aware of sickle cell and the research that is going on. We have someone from the center always bring the update.
Okay. Well, three lovely ladies to represent such a serious matter here is a good thing, and all of you are very knowledgeable in what you do. So we're going to take a commercial break and come back with some more information about the Sickle Cell Disease Association.
Okay.
We'll be right back.
How do you convince a 14-year-old girl that hair doesn't matter? When the diagnosis is childhood cancer, CureSearch.org can help. You're not as alone as you feel.
And welcome back to the show. For those of you who are just now joining us, we have our panelists here to discuss the Sickle Cell Center and what the services are provided by it. Now, Dr. Sherney, I want to start off with you because mainly a lot of people get confused about what sickle cell is, the difference between trait and, what's the other word?
Sickle cell disease versus sickle cell trait. That's the thing I'd really like to make clear.
Okay.
You know, sickle cell disease is a blood disease. It's a disease of the red blood cells. And the red blood cells take on an unusual shape. They're shaped like a farmer's sickle. My patients tell me we should call it banana cell disease because they don't know that sickle is a tool that a farmer uses to cut weeds. But anyway, if you get sickle cell disease from your parents, okay? Now, in order to have sickle cell disease, you have to inherit 2 doses of the sickle gene, one from each parent. It takes both parents to give a child sickle cell disease, okay? If you have only inherited 1 dose of the sickle gene, then you have sickle cell trait, okay? And the most important thing I want people to understand is that sickle cell trait is not a disease. It doesn't make you sick. It doesn't cause any of the health problems that you see in sickle cell disease. The significance of having sickle cell trait is that you can have a child with sickle cell disease. Now, we are not trying to wipe sickle cell disease off of the face of the earth. I have 750 patients with sickle cell disease. I'm sure they're all glad to be here. But what we want is for families to be able to make good decisions about childbearing, for families to know when they're at risk for having a child with sickle cell disease and exactly what their options are if they're at risk for having a child with sickle cell disease.
Now, let me ask you this. How would one, you have a couple who's, happily married or involved, and the woman becomes pregnant. Are you suggesting that couples need to, if they're going to plan children, have their blood tests taken and everything to make sure that they're of
Marsha, you know what I'd like to do? Go way before then. When they're teenagers, I'd like for their parents to talk to them. When they sit down and talk to them about responsible sexual behavior, the parents need to know their children's trait status so that they can teach their children, if you have sickle cell trait, if both parents have sickle cell trait, there's a 1 out of 4 chance of a child having sickle cell disease. Now, since 1987, every child born in the state of Michigan was tested for sickle cell disease. And when we look for sickle cell disease, if they happen to have sickle cell trait, we find that. Okay. So if you are 17 years or younger, your sickle cell trait status is available, and we can get that information to you. And our point is so that with newborn screening, what happens is I call the parents in the Detroit area and tell them if the child is diagnosed with sickle cell disease. And frequently, that mother was not aware of her risk of having a child with sickle cell disease. And it's a very different experience to have a stranger call you and tell you you have a child with sickle cell disease, you know, and they're like, well, how did you get my phone number? And who are you again? And my baby has a doctor, and the baby's right here in the bassinet. What do you mean? There's nothing wrong with the baby, you know? But if the mother had known her trait status and known the baby's father's trait status, then she would have known she was at risk. So that's how we do it.
Well, you know, unfortunately, I did have family members that had it. My cousin and his wife, their son did have sickle cell, and at the time, I'm a child myself, I wouldn't realize the impact of it, but our cousin didn't live very long. So you know, and everybody's saying, oh, this baby has sickle cell, and at that time you just heard about something, you knew nothing really, and you know, and he was very sickly young man for a long time. You know, and
that's a really important point, and I kind of just want to jump in there because one of the most significant things about sickle cell disease is how variable it is. Every patient with sickle cell disease is different, and there's some people that have a lot of problems. There are other people that have very few problems, and it is true. And one of the things that the agency is all about is dispelling myths. One of the big myths is that everybody with sickle cell disease dies by the time they're 21, when the fact is the vast majority of people with sickle cell disease live well into adulthood. Now the main health problems that people have with sickle cell disease, the most important health problem in sickle cell disease is the fact that people with sickle cell disease don't fight infection well. So part of our newborn screening is to find out when the baby is first born that he or she has sickle cell disease, so that we can get them on antibiotics to decrease their chances of getting a serious infection. The other really common problem in sickle cell disease is pain. And that's part of what makes sickle cell disease so difficult, because children and adults with sickle cell disease have intermittent pain. The pain can be very severe. The pain is very unpredictable, so it can be very disruptive of lives. And so that's where the agency comes in to try to support patients in terms of keeping jobs and staying in school. Ms. Milton referred to our tutorial program, our summer camp program, to help them grow up feeling good about themselves and get that separation from the overprotective parents if that comes up. And then the other big role that Ms. Milton should talk more about is educating people about sickle cell trait and their risk for having a child with sickle cell disease, because that's the main focus of the agency.
Well, Dr. Shirley, I have to admit, you probably answered most of the questions. You did a wonderful job, but overall, and I respect that, because we really don't know. We really don't know how to check for it, how to secure the future of our children, and let them know that they can be productive citizens, and work and do everything else like anyone else. I've had clients with sickle cell who have worked and then later on, have passed and things like that, and it affects me as well. In my job line of work, it affects me, the outcome of my clients as well. So I do respect the fact of what you're saying is so true, and that we, as people, should be trying to make sure that we're covered with all information, especially when we have little children. And that makes sense. So, Jatan Milton, what I wanted to find out is that if I was to come to the agency and I said, I don't know if I have sickle cell or if I have the trait or whatever, can I come and get some literature or be tested? What would you offer me?
Number of things. For persons who don't know what their test result is, if they come in, we can provide the sickle cell test. We generally try to do that by appointment, since there are certain days when the laboratory technologist is in, but we can make that available. They can have the sickle cell test. Within a number of days, they can get the sickle cell test result. That's one of the services. The other service is that if we find parents who have sickle cell trait, then we want to sit down and we want to talk with them. We have education sessions with persons who have the trait, because we really want them to understand that if they have the trait and they marry and produce children by another person with the trait, for every pregnancy, there's a 1 in 4 chance that the child may have sickle cell anemia. Many people say that I don't have sickle cell trait. I I know I don't have sickle cell trait because I don't have the health problems. And we say to them that if you have sickle cell trait, you would not have any health problems. You could live a complete lifetime and never know you have the trait. So that's why we encourage those who are approaching the childbearing stage and those who are within the childbearing stage to please have a sickle cell test and then to come in for the education and the information. As Dr. Sherney has said, too often we have calls that come in and person said, well, I have a child who has sickle cell anemia. How did that happen? And they even ask us, why didn't you tell us? And we are constantly calling people and asking them, please be tested. And after being tested, if you have the trait, please come in for the education. That is crucial and it's very important. So that's an important message. In addition to the education for sickle cell trait, we also have services available for those persons who have sickle cell anemia, as Dr. Sherney has mentioned. The tutorial program, sometimes we have persons who are ill frequently. Not everybody, but there are some, and they may be in and out of school. And sometimes they miss basic concepts that are being presented at the time they are out. When they return, the teacher and the class has moved ahead, so then they are automatically behind, and with additional absences, they can fall further and further behind. So we have the tutorial program where we provide tutors who actually do one-on-one tutoring in the home 2 days a week, 2 hours per session. And they help the child to remain abreast of the homework. And in addition to that, they help them with developing those basic skills that they may have missed.
I don't mean to cut in, but I know somebody didn't know that. There's got to be a parent somewhere that doesn't know that.
Certainly.
So after the show is aired and you get a floodgate of calls for the fall season of school,
Exactly.
you'll know why.
Exactly. That's very good.
Wow.
Because we're doing pre-enrollment for the tutorial program right now. We want to start as of September, the early part of September after school starts. We don't want to wait until January. We want to start now. So if there are individuals who have children, we focus on the target population of those children who have less than C average in reading and math, or who did not get promoted because of sickle cell related absences. So we encourage those parents to please call the center and begin to register and apply now. We're doing pre-enrollment.
All right.
In addition to that program, we also have the summer camp, as Dr. Sherney has mentioned, and 2 weeks ago we had 55 individuals who attended the summer camp this year, and they spent a week and they returned last week. And we have pictures to show the excitement. Many of them come back very different when they left. Some were crying, I don't want to go, but when they return, you know, the chest is out and the head is up because they are really excited. That, again, is for persons with sickle cell anemia. That's a free service to the families. So we encourage parents to be aware of that and to begin to have discussion. Now, we also have... I'm sorry.
Nope, that's okay.
You're on
a
roll now.
You're on a roll, but we're going to take a break and come back.
Very
with,
good.
Look, ladies and gentlemen, I know this was good, and I had to cut her off, but we'll be right back. Okay.
Thank you.
Okay.
My nerves stand on end. My palms sweat. And everything's a blur. The rush is so intense. All I want to do is get even higher.
Andrea Moretti is under the influence of her local teen center volunteer. Each month, she helps Andrea stay on top of the world and off drugs. Be a coach, a mentor, a volunteer, because you have something to offer.
And welcome back to the show. For those of you who just now joined us, we have the Sickle Cell Disease Association of America, the Michigan chapter, and a wonderful panel of informationists that can help you out, ladies and gentlemen, in learning more about sickle cell. So I want you to get your pens ready to write down the phone number in reference to the Sickle Cell Disease Association so that you can call these ladies individually, ask them questions, and if you are a person that's interested in the fundraiser, you can find out more about that too. Now, I left off, I didn't mean mean to cut you off, but you're on the road there. So I want to go back to you, Jatan Milton, and you can tell me what it was you were going to tell me about the beautiful range of services when people came in from their camp. Was it a camp?
The summer camp.
Summer camp.
And I mentioned the tutorial program and the summer camp. We also have a career development program for individuals who have sickle cell disease. And we have a career coordinator who works with them first to help them to begin to explore careers of choice and to actually study the careers. You mentioned that some association with Michigan Rehab, and she works very closely with Michigan Rehab. We have about 25 students who have been referred. They're in tutorial training programs, and some in college taking different courses. So the career program is very active. It's very important. We encourage persons who are ages 14 to 25 at least to actually get involved in looking at careers. We also have a social service worker, a patient advocate, who works with families surrounding basic needs. She talks with them. She finds out what some of their needs are in terms of a disease adjustment, concerns they have about sickle cell disease, and again, basic needs, and she assists them with that. The other key thing I'll say is that we are really available to do public presentations. So we have different churches, we have different groups who can call the agency and say, hey, I want a person to come out and share information with us about sickle cell conditions, about your agency. And we are ready and willing to go. We do health fairs and do displays at health fairs. But the whole mission of the Sickle Cell Center is to provide services to the community, to individuals who are detected as having the trait, and persons with sickle cell disease. And we are proud and pleased to serve.
Well,
we serve with love.
I must say, I must say, you represent very well.
Thank you.
Very well. Okay. Now, Ms. McBride, I didn't want to leave you out over there, Maxine McBride. Okay. But I know that you are involved with and I should say more so as a board member, you oversee the annual Cynthia Cole banquet.
Yes.
Okay. Tell us about that.
Okay, the banquet is a part of Friendship Baptist Church mission outreach.
Okay.
And it was organized to help raise funds and to make the public aware of sickle cell disease, and also to provide funds for the parent group. We're proud of the fact that we're able to help send some of the youth to camp who otherwise maybe would not be able to go. And for the last 30 years, we've held either a banquet or a luncheon to raise funds for the program. This year was our 30th anniversary. And like I said, we've given close to $100,000. We keep the costs down so that people can afford to come to the banquet, but because they also get information. It's more than just a fundraising, it's an information outlet as well. Okay. And
now your banquet is every year around what time?
In May.
In May.
Around the third weekend of May.
Okay. And what is it that you're having in December of this year?
Okay, what we're having in December of this year is the board of directors are sponsoring a play at the Detroit Repertory Theater. Okay. And that will be December 17th. Okay. And this will be our third time as a fundraiser from the board of directors.
Okay, this is December 17th, 2006.
Yes.
Okay. So that sounds, now you know what, to have funds raised for a service is wonderful, because a lot of people think that, well, if I go here, I'm not going to be able to afford it. Okay, but obviously you all are doing an excellent job to letting persons of low income to no income know that you can come in and receive services, be tested, have the children tested, and everything else.
Yes, let me just say this, all of our services are free. We do accept and we encourage donations, because that's a part of the way that we are able to send children to summer camp free, provide tutors. We have funding from Michigan, State of Michigan Community Health. They provide funding for operation and for our major staffs. United Way will provide funding for the career program and the tutorial program. But even with that funding, oftentimes we need additional funds to do the special things that we do. So we encourage contribution, and certainly the fundraisers help us with doing those things. But all of the services, the testing, the education, the displays, career tutorial are free services to the parents and the families.
Now, how can one get in contact with you?
They can call us at area code 313-864-5600. 4406,
Okay.
or they can come by the Sickle Cell Center, 18516 James Cousins. We're located between Schaefer and 7 Mile. Those are the two larger cross streets.
Okay.
So either come in or call.
Okay, okay. Now, I know, Dr. Sherney, you have your own office and everything, but if someone had a question for Dr. Sherney or had, wanted to be tested or whatever, can they contact her through the Sickle Cell Center?
That's probably the better way for either contacts for either one.
Okay.
They can contact me, and certainly I will get the information or get the information to them. I'll handle it from that point, and they can be assured that I'll follow through with that.
Okay, especially
Yes.
those who want to be involved with fundraising
Yes.
and stuff like that.
Yes.
Okay, that's a good thing. Okay.
Right, and again, they can call us at 864
Okay.
4406.
All right. Now, see, don't say anything when you get a lot of phone calls.
We're there for that.
All right.
We're
all
there
right.
to serve the community, so we welcome that.
Okay, well that's good. Like I said, I had relatives that had sickle cell, and as a kid I didn't understand what it meant. But I wanted to ask Dr. Sherney, is there such thing as a? I know you said some people thought it was called the half moon.
Mm-hmm.
Okay.
The crescent shape, the sickle shape.
Right. Now, is there a mark on a person's body, like they can have it on their face? Because my relative had something, and he always looked like he was broke out.
Okay.
Okay.
All right. No, that was something, and that's a really important point because a lot of times people tend to blame certain things on sickle cell disease.
Okay.
It might not
Okay.
even be related to the
All
sickle
right.
cell
Well, let's
disease.
correct them.
But as I said, sickle cell disease is a blood disease, and we talk about that sickle shape. That is the shape of the red blood cell.
Okay.
And when the red blood cell takes on that shape, one thing about it is it's sticky, and it's fragile. So these red blood cells, one of the things they do is they block blood vessels. And when the blood vessels get blocked, of course, red blood cells carry oxygen to all the different parts of your body. So if your red blood cells, red blood cells have this unusual shape and they're sticky and they block blood vessels, then that part of the body doesn't get oxygen, and that's what causes the pain.
Well, ladies, we're at the end of the segment of our show. Is there anything that we need to know for our viewers?
Marcia, there's one other point I'd like to make, and that is that there are really 3 common types of sickle cell disease, And so there are 2 other traits that can combine with sickle cell trait to produce a baby with sickle cell disease. That's hemoglobin C trait and thalassemia trait. So young people in childbearing age, in order to make informed decisions about childbearing, really need to be tested for sickle cell trait, hemoglobin C trait, and thalassemia trait.
Okay.
Yes, I wanted to get that in.
That's fine.
Okay.
That's fine.
All right.
Well, I want to thank you all for coming. Okay. I appreciate it very much, and our viewers will appreciate it even more.
Very
So, Ms. Milton, you want to give out that number one more time?
That number is 864-4406, 313 area code.
Okay.
864-4406.
Okay, Ms.
Thank you.
McBride, we're going to have everybody remember that December 17th, 2006 is the fundraiser for the Cynthia Cole?
No, for the Sickle Cell Board.
Sickle Cell Board, okay, 2006, December
Cynthia Cole.
17th. Okay, we're going to keep all that in mind. Keep us informed of any upcoming events, and we'll try to be there. Okay,
Thank you.
and thank you, Dr. Sherney, for all that helpful and supportive information, because you clarified a lot of things for people.
Good. Thank you
good.
for having us.
Okay, you're
Really
welcome.
appreciate it.
Thank you.
Okay.
Thank you.
Well, ladies and gentlemen, you can't get any better than this. If you don't like to read a lot of literature and you don't pay attention to a lot of commercials, why not watch Just Ask Talk Show so that you can learn firsthand about services and agencies such as the Sickle Cell Disease Association of America, the Michigan chapter. We here at Just Ask are here for you, so if you have any questions, comments, or concern, call us at 248-988-0250, 248-988-0250, or drop us a line at justasktalkshow.org. And what do I always say? I'm your host, Marcia Florence. If you know someone with a disability, or if you just have a general questions, don't be afraid to ask. Just ask. I'm your host. Thank you.